So now we're going to talk about what to do while you're at work, and Dr. Ahmadpour is going to take us on with that.
Yeah, so continuing on, protecting yourself at work, physically, mentally, emotionally. And it starts with this sort of idea that you matter. That may not be the messaging that you receive or how you feel about things, but I'm here to tell you that you matter. And during this time, we're really seeing how the health of the individual affects the health of a community. So keeping all of our individual health and well-being is so important. So you matter, and that means that it's essential that you care for yourself and honor your needs. And you have needs, everyone has needs, and it's okay to acknowledge them and take the time and space to care for yourself. And so beginning with, permission to self-protect. So while you are at work, taking all of the measures that you can to protect yourself. And your doing so is not a sign of weakness or a sign of you being a jerk. If you choose to keep some physical distance between yourself and others, that is you protecting yourself, and by doing so, you are protecting your community. So you have permission to self-protect and to take care of your needs. If you need the permission.
Yeah, sometimes you do. And then I'm going to talk a little bit about some physical ways to do that. Two are using masks, a face mask, and I don't have one handy, but even though prior people were saying please reserve them for healthcare workers, it's changed, and honestly the nation is starting to take a harm reduction look where it is important to reduce the burden of transmission, not just cut it out completely. So if you want to wear a mask, please do. If your boss is giving you a hard time about it, there are a lot of places like OSHA or the Bureau of Labor, I think Labor and Industry, BOLI, and of course the governor's office and your representatives. Like, we really want to make sure that you know that people have your back to protect yourself. So if you can use gloves, these are some nitro gloves. I'm going to talk about some medically oriented glove use that might help to quench some anxiety you have about whether what you're doing is working or not. So a really quick introduction to medical glove use is we have gloves, we have the outside of the glove, and we have the inside of the glove. And it's important to think about that. This is a thing about the outside versus the inside and creating a barrier between them, right? So if you put on your gloves and then you touch your face, you have just negated that barrier of outside to inside. So not only is the glove a barrier, but it's also a physical reminder on you to not do the things that would normally be compromising that connection. So to put them on really fast, outside to outside, get one on, and then make sure, I don't know if you can see this, touch the outside and hold on to it, and then get the inside onto the inside, right? So then as you go through your day, you remember this that you see is the outside, this is the inside. So you can take them off if you need to use your physical hands to do things. So if you're in a place where you have a bad habit of touching your face or scratching your head or things like that, one of the things we do when we're doing surgical procedures is to literally clasp our hands in front of us so that our hands are busy, and we remember not to touch, this is the outside and not the inside, right? Then when you're done with your gloves, what you want to do is grab that outside, pinch it, and pull it off, and then ball that up so that the outside is touching the outside. Hook your finger underneath like this, inside to inside, and then that's a little package you can throw away, and you haven't just gotten all of the outside world back on your hands. Still a good idea to wash your hands, just because you never know what came in contact or splashed or anything, but that's a good way of using gloves that you can practice. There's probably YouTube videos about it too. Okay, also wanted to remind you emotionally, speaking of touching your face, emotionally, that you're allowed to do C-level work right now. There's been a lot of great memes going around saying you're not working from home, you're at home during a crisis trying to work. right? So you're not just essential workers doing your work, you're in a crisis with the rest of us. And people will have deadlines, people will have qualities and standards of care, and of course that's true. But remember, when you're in school, there's exemplary, and there's above average, and there's satisfactory. And right now we need to hit satisfactory work. If there's something we're skimping on it, will be an actual danger to things, then absolutely you want to meet that standard and go above it. But this is no time to really push and be exemplary or at the honors level. Really do C-level work. It's okay. Right now, society will survive if you just do passing level work. Okay, and then the last thing was, remember to reframe things. It can be very frustrating to have a lot of emotional burden come on you, and you can get, especially when we're shifting what counts as success. So when you think about changing from, exceeding over the bar and instead just being satisfactory, reframe what counts as success. If it's something like just getting through my work shift, that's a success. Or I'm gonna try and smile at and be smiled at 5 people today, even though I'm feeling really crappy, that's a success. So create something that's achievable for yourself so that you have a sense of success in the world. And that way you have more encouragement in the day, even if you have a very stressful work. Okay.
Right. Some other physical ramifications for how you can protect yourself while you're at work. One is to create space between yourself and other people. And you know about that. If you've heard about 6-foot rules already, you're probably enforcing them with your patrons of your business. But also pay attention to the space between yourself and your coworkers. We don't want any of you getting sick, but if one of you gets sick, we don't want it to spread to everyone else at the same time. Be particularly mindful about that when it's shift change time. So there's a whole bunch of new people coming in and there's a whole bunch of people preparing to leave, because that's a time it's harder to get that physical space. That might be something that you need to talk to your HR department about. It might be something that you need to talk to your management about, like different systems of how you can create that space so everyone has a place to flow. Another thing, coughing and sneezing into your elbow. If you don't have a tissue handy, if you do have a tissue handy, throw away the tissue and then wash your hands as soon as possible afterwards. If not, you can use hand sanitizer too. So when we wash our hands with soap and warm water, that's the most effective way to remove this virus. And like Dr. Allenton was talking about with the inside and the outside, our skin is a good protective barrier, but it doesn't help at all if we take that protective barrier and then touch our face, because that's where we can absorb a lot of virus in its little capsules. So we want to wash our hands with soap and water because it breaks down the capsule of the virus, and preferably warm. And if we can't do that, then use alcohol sanitizer with at least 60 or 65% alcohol base. I forget exactly which one. And then try to avoid touching your face. And some tools to do that are actually to use tools. Like if you have an itch, you can scratch your face with something other than with your hand. Also remember to take breaks throughout the day while you're at work. Not necessarily like a full 15-minute break, although I want you to take those too. More like, okay, so I was just doing this, this, and this. Now, how am I? Where am I? Am I breathing? Do I need food? Do I need to use the restroom? Do I need a drink of water? What do I need right now? Because there's a lot of being in these essential work environments, there are a lot of other people's needs that are happening in your presence, and you're bound to pick up some of that. So you're feeling other people's anxiety or other people's fear, other people's need to get things done, or even their anger. Some people are showing up with their fear is showing up as anger, and I know that some of it's coming out at you guys, and that's really unfortunate, and it's not about you. And I'm hoping that you can take a few moments to let that move away from you and not be yours. And also remember, when you're at work, if you're feeling something, if somebody makes you feel angry, or you feel angry in response to a situation, or you feel sad or scared or grief in response to a situation, it's okay to just shut that feeling down to get through your work and deal with it later.